I'd like to welcome the public, the press, and our Director of Public Health, Rachel Wigglesworth, to our full council today, which is a virtual meeting with remote attendance by councillors and remote access of the press and public, and will be held in accordance with the provisions of the local authorities and police and crime panels, coronavirus flexibility of local authority and police and crime panel meetings, England and Wales, Regulation 2020. I would like to start the meeting by having a roll call of members, please. Have we got Marion Barclay?
Yes. Present.
Thank you. Adrian Davis?
Yes, good morning, everybody.
Thank you. Tim Dean?
Yeah, I'm here.
Robert Dorian Smith?
Good morning, Robert. Yes, I'm present.
Thank you. Francis Grottick?
Present.
Andy Guy?
Good morning and present.
Thank you. Harry Legg?
Yeah, good morning, Chairman.
Thank you. Dan Marcus?
Yep, I'm here.
Thank you. Avril Mumford?
Yeah, good morning.
Thank you. Mike Nellams?
Good morning, thank you.
Ewan Roger?
Yes, good morning, present.
Thank you. Steve Sims?
Yeah, present, thank you.
Jonathan Smith?
Good morning.
Thank you. Steve Watt?
Yes, morning, Chairman.
Thank you. And Joel Williams?
Yes, I'm here.
Thank you very much indeed. I would just like to remind members, please, to stay on mute until they're asked to speak. Unless I forget you or there's something urgent, then obviously please butt in, but I will call you in alphabetical order. For voting, we will take it that unless there are votes against, I will ask for votes against or abstentions. If you're silent, you will be deemed as being for a motion. Thank you. We'll start with agenda item 1, declarations of interest. Please, do I have any declarations of interest?
Yes, Chairman, from Mike Nellams, on agenda item 8 as an employee of Tresco Estate.
Thank you.
And from myself, Chairman Robert Dorian Smith, agenda item 8 as it's an estate property.
Thank you. Any other declarations?
Councillor Smith, just a minor declaration on item 12 as a recipient of a business grant.
Okay, thank you.
Robert, could I ask a question regarding if one withdraws from the meeting, how does one rejoin if an item's been considered in which we've declared an interest?
I understand you can redial in if that's possible.
Andy Thomas will be in touch with you as long as he's got your contact details, Councillor. And
okay,
then
if somebody could give me a ring on the mobile or text, then...
Exactly. As long as he's got your details.
Well, I know Robert has. I'm not sure whether you have, Andy.
Yeah, it would be useful, actually, just to...
If you want to email Andy your details, Robert, that would be...
Yeah,
Okay.
I'll just email you quickly on your personal email address, Robert, and then you can reply with your number.
Good.
You can do the same for me, Andy, as well, thanks.
Okay,
Yes.
we do the same for Councillor Nellams. Thank you. So I'll move on to agenda item 2, which is the minutes of previous meeting. To confirm as a correct record the minutes of the meeting of the Council of the Isles of Scilly held on the 12th of May 2020. Do we have any issues with these minutes, please, councillors? No? Then in that case, could I please have a proposer for the adoption of the minutes?
Councillor Grottick's happy to propose that, Chairman.
Thank you. And a seconder?
Second.
Thank you, Councillor Mumford. Anybody against the adoption of these minutes? Then they're passed unanimously. Thank you. I come on to agenda item 3 now, which is Chairman's announcements. And I would like to once again thank our corporate leadership team and all the staff for their continued efforts through this unprecedented crisis. Special thanks also to the social care and NHS staff and all those in the community who are pulling together to deliver for our residents and keeping Scilly prepared as we move into the recovery phase and to a better future. The Chief Executive and I continue to work with the Cornwall and Isles of Scilly Leadership Board, our MP Derek Thomas, and all our partners to lobby government for the support that we need. The funds required top up the discretionary grant urgently needed by our businesses. We are also pushing hard for the answers we urgently need for our community questions. We look forward to the time central government will allow us to be able to warmly welcome safely our valued visitors back to the islands. But we need answers to such questions as what do our businesses do if they have a visitor showing symptoms of the virus? We know that if they are very ill, they will be medevaced out by the Navy. However, if their symptoms are mild, how do our businesses deal with them, and who bears the cost of how these cases are treated, be it in isolation or transport back to the mainland? There are various options, and our partners in public health and central government are helping us work our way through the various scenarios. We will continue to seek guidance where we desperately need answers. We have been assured that there will be guidelines very soon. We're also working with our grocery shops to make sure we have a good system in place that will be workable for all staff and customers. It is also very pleasing that following the opening of some of our non-essential retail last week, our environmental health team received a letter of thanks for the way in which they conducted an inspection to make sure of compliance, which is an excellent start. Thank you. I move on to item 4 on the agenda, questions under Standing Order 14. I have none. Item 5 on the agenda, to consider reports from committees, including the receipt of minutes and draft minutes for information. We are awaiting minutes for the IFCA held on the 11th of June, but we do have minutes for Scrutiny Committee, and I hand over to Chairman of Scrutiny and Avril Mumford. Thank you.
Thank you, Chairman. I think we could take these minutes as read. The recommendations that Scrutiny are making are going to come up in agenda item 12, so we could leave any discussion until then, I think, if that's all right with everybody. I don't think there's anything else to say, so could we have a proposer for the minutes, please?
I don't think you need a proposer there, Chairman, for those minutes, because you're not approving them as such.
Okay, right, thank you, Andy. Okay. Thank you, Chairman.
Thank you, Councillor Mumford. I move on now to item 6 on the agenda, to consider motions in accordance with Standing Order 12. I have none. Item 7 on the agenda, urgent items. I have none. We come on to part 1 now, and I would like to arrange for item 12 on the agenda, the COVID-19 emergency planning update, to be taken as item 8 on the agenda before the planning applications, because we have in attendance our Director of Public Health, who will not be able to stay till later in the meeting. So we will now move on to item 12 on the agenda, which will be introduced by our Chief Executive, Paul Masters. Thank you.
Thank you, Chairman, and good morning, members. Today, we're considering the third COVID update report that has come to full council. And of course, it's worth reminding ourselves that while still many councils across the country are yet to have their first meeting under these new arrangements, the Isles of Scilly's leading the way in terms of making sure that good governance continues. So the third report is before you today. As the Chief Executive, I'd also like to mirror the thanks to all the staff who continue to operate the services in these difficult times that we're in, and ensuring that people are still able to access the services that they require. We'll all be aware that it's been very easy to lock down services, but it's much more difficult to start them up again, and that's the process that we're currently in the middle of now. Also, I think all of us have had some level of frustration and community worries about advice, which sometimes is conflicting, particularly in the media, and particularly as this virus and this pandemic unfolds. But as a council, we've been committed to sharing as much information as quickly and as timely as we can, and pretty much on a daily basis there have been updates throughout this crisis in trying to keep the community up to date and businesses up to date with current guidance. Similarly, it was very pleasing, and it will be discussed later, that the consultation exercise resulted in such a large response rate, which again was able to show particularly people's fears and worries and hopes in terms of as we come out of the lockdown. For the first time, you'll see a very thorough appendix to the report, which gives you updates on all of the key services of the council and what state they're in, and you'll see a number have already begun to open or are planning to open, but continue to operate safely. You'll also see an update on my decision on the business grants taken in consultation with the Chairman and Vice Chairman, and our disappointment that of over £600,000 worth of requests, we so far have only been able to distribute just over £215,000, and based on a third of what people have asked for. We continue, the Chairman and I, almost on a daily basis to lobby both our local MP, Derek Thomas, and government and MHCLG, as does the rest of the country, for the Treasury to release further funds in order that we can distribute the remainder. And we still are hopeful that will happen, and we will continue to lobby for that money to be released. The key issue of the moment, of course, is the guidance that people so desperately want, particularly as today's announcements from the Prime Minister is likely to talk at long last about the 4th of July being a date that the hospitality industry can open. And of course, some of the questions remain to be answered, and I know particularly the issue of what happens when people display symptoms if they're staying on the islands is of key concern to everybody. I'd like to reassure members that I have also brought that up with Malcolm Bell, who has taken this issue up with the Tourism Minister direct, with the senior civil servants, and yesterday on a call with the Department of Health, on a national lead call, it was agreed that the issue would be raised with the Secretary of State for Health, Matt Hancock, particularly on the issue of repatriation and how that might work. I'm also in active conversations with the travel operators and local businesses, and I'm hopeful that we'll be able to come up with a solution that works for all over the coming days. But we're not quite there yet. A key piece of work that will now happen, and Rachel will no doubt give more detail later, is on the issue of outbreak plans, and these are key. The outbreak plans are what I hope will give people, both visitors to the islands and people on the islands, the confidence that we are prepared and have thought of every eventuality as far as we can to ensure that the risks are minimised on the islands. They cover 7 key things and need to be completed by the end of June. And then we'll be subject to a hopefully light-touch national assurance process to ensure that all the plans across the country are similar and ready to go. Communications, of course, is also incredibly important. And alongside the Outbreak Board, which I'm sure Rachel will talk about, there's a need for an Outbreak Engagement Board. This board will need to be chaired by the chairman of the council and will be particularly for the Isles of Scilly. And the suggested membership for the board to be debated later is the chairman, the vice chairman, the chairman of the Health and Wellbeing Board, an off-islands member representative, a representative of the Director of Public Health, a business representative, a communications specialist, a link to our partners where we meet weekly in terms of a multi-agency approach to the islands, myself and a representative from the Duchy. There's still no guidance on these boards, but however, the chairman and I are keen that we push ahead, so we're hoping to form that board this week in order that we can have a single point of contact for all communications. I'd also like to thank all of our partners across the island who've helped us so strongly work together to be prepared for dealing with this crisis. Things are still fast-paced, but as we move now to outbreak plans and begin to think of the future, I'm sure our minds will move towards support for our transport network, the ongoing support that's going to be required for the business sector, and the hardship which I'm sure will continue to emerge as we go towards the winter. With your leave, Chairman, I'd like to now hand over to Rachel Wigglesworth for any key points she wishes to raise.
Thank you very much, Chairman. Good morning, Rachel Wigglesworth, and welcome to our meeting.
Good morning, Isles of Scilly, and it's nice to be able to speak to you directly. I came into my post in April this year, and as you can imagine, it's been a challenging start to this role. But I just wanted to say a few points about some of the work that we've done in terms of public health very quickly to add to the report. In public health, we've been involved in the pandemic since the middle of February in terms of the different phases that are outlined by the government, the contain phase. And this was really we put a lot of effort into working with our colleagues in Public Health England to identify cases early and trace the contacts with the aim of trying to take control of the pandemic. Clearly, we then moved into the delay phase from the 12th of March. And in that phase, as the numbers started to increase, that containing became more difficult, and that phase began moving into the delay, and the lockdown was introduced as a result. So now, from the 28th of May, we're moving into this next phase, which we call the test, trace, and contain phase. And this is where we return to trying to proactively reduce infections, transmission, and control outbreaks with the objective of protecting all vulnerable people and reducing the health impact. So that test, trace, and contain phase is absolutely what Paul has outlined will be a central part of the ability for the release of the restrictions and all that brings and the implications for the islands. So I just want to very quickly reiterate the structure that's going to be put together in order to have oversight of that test, trace and contain phase. They're called the local outbreak management plans, and as Paul said, we will be putting together a joint plan for both Cornwall and the Isles of Scilly, which outlines the approach and the teams that will be in place, a multi-agency approach working with the existing Public Health England expertise, public health teams, colleagues and environmental health officers and officers and partners in the NHS to ensure that we work in a collaborative way, we understand each other's roles, and that we have a clear plan for the high-risk settings that Paul outlined in terms of the 7 themes that we're required to address in the plan. So I won't go into detail on that. That is in the report, but this is going to be completed by the end of June. The Health Protection Board, which will be established, is the more technical team that will be working across Cornwall and the Isles of Scilly, which will include experts from Public Health England, Public Protection, CCG, Infection Control at the Trust, and also emergency planning and representatives from the Council of Isles of Scilly and Cornwall Council. And also we'll take on a key role for mobilising the testing approach, working with our military liaison and the mobile testing units with NHS and the Department of Health and Social Care. So we're working hard to establish those. The first meeting is this week, and as Paul said, local outbreak engagement boards will be established. So just wanted to say a couple of things about the context and the overview of that pandemic, which is in the data in Appendix B of the paper, that in Cornwall, that has been updated, is updated every week, that overview of the pandemic, to just confirm that to date there have been 594 cases in Cornwall, as we know, not detected on the Isles of Scilly, and this has led to up to the ONS data released Tuesday last week with 203 deaths across all different places of those locations of those deaths, including 119 in hospitals, 66 in care homes, and 18 elsewhere in other settings and at home. So the predictions were a lot worse than this in terms of the modelling of the reasonable worst case scenario. So at this stage, whilst that is regrettable, and we have had lower rates of deaths compared to other local authority areas by an age standardised comparison. So we feel like we're moving into the next phase. We've worked as hard as we can to contain and delay the pandemic previously, and we will be working really closely with Isles of Scilly partners and officers in this next stage to protect the population as best we can. So thank you.
Thank you very much indeed. Members, you have the report in front of you. There are 11 recommendations that we'll take in due course, but I will now run through alphabetically and see if there's anything any member wishes to say about this report, or any questions that they have for either our Chief Executive or the Director of Public Health. So first of all, Marion Barclay.
Thank you, Chairman. I don't have any specific questions right now. I'm sure I shall after I hear discussion on it.
Okay, thank you. Adrian Davis.
Thank you, Chairman. I'd like to just comment on and bang on again about testing and the use of the word testing, and make it quite clear, or hope that people can use the correct nomenclature for the testing. And first of all, I'd like to say that there is no direct connection between testing and infectiousness. So testing is an aid to tracing. I fully accept that, but it's no guarantee of being safe. The further point I'd like to make is that there's some confusion over the words antibody testing and antigen testing. At least two places in the minutes. At least two places the word antibody is used. Now, an antibody is produced by the body in response to an antigen. Antigen testing is actually testing for the virus. The antigen is the virus. So antibody testing, which is referred to, is a way of telling that somebody's had the disease, and does not really help us to detect infectiousness, which is, of course, what we're really concerned about. It's a very useful epidemiological tool, but I would just make another plea, again, for perhaps slightly better understanding, and make sure that we're referring to antigen testing when at times we're referring to antibody testing, and make it clear that I know it's jargon and difficult to get one's head around, but it is important when we're actually talking about the results and what we're actually trying to do. Thank you.
Thank you. Rachel, would you like to respond?
Thank you, Chairman. I think I would just agree with Adrian on those comments. There are two types of testing available. One detects the virus, which we tend to call the PCR virus testing, and the other one is the antibody testing. And there is some information on the Public Health England websites about those different testings.
Okay, thank you very much. Councillor Dean.
Thanks, Mr. Chairman. Nothing really to ask. I just want to say publicly that I share the community's frustration at the lack of clarity from government, and hopefully we'll get some some clarity on the reopening of accommodation and hospitality, etc., this afternoon. But I think we should all take comfort in the amount of work that's been done, and I think this report really shows how much has been done, and all the thinking and the planning about what might happen and what could happen and how we deal with it, and a bit about the box thinking about how we deal with things, especially when we're talking about people with symptoms or people that are asked to self-isolate, and how we get over that, whether we transport them off the islands or whether we find some accommodation for them down here. But hopefully all these things will become clear in the next day or two. I mean, we're all hoping for some official guidance from the government, so we sit and wait and hope for the best. That's it, really. So no real questions. Thanks.
Okay, thank you very much. Councillor Dorian Smith.
Nothing to add, Chairman. Very, very encouraging and comprehensive report, and very well described by the Rachel just now. So no, nothing to add.
Thank you very much. Councillor Grottick.
Thank you, Chairman. I would agree with Councillor Dean and welcome this detailed report and the continuing work that will help us to be as prepared as we can be when the government decides to relax the current guidelines. I know members and officers are all working together to try and address our logistical challenges and to work towards a bespoke arrangement for the benefit of all our community. To be honest, on a personal level, I had hoped that this bespoke arrangement might allow us to lag some little time behind Cornwall so that the situation there could be assessed first. However, this would seem not possible, and we must abide by government guidelines. It is a most challenging time, and the community must recognise that we cannot deviate. However, I hope we can argue for the cautious and measured approach that is outlined in the recent Council press statement from our colleagues in Cornwall. There are many we must recognise in our vulnerable community who are very apprehensive of any increase in visitor numbers. Yet we must also recognise that for some, economic viability concerns are really significant. I trust that we will be able to welcome those visitors who have decided to visit, whilst we beg them to be mindful of our vulnerable situation, not to be complacent, and to wear a face covering in crowded spaces, which will quickly be most of Hewtown. Colleagues may wish to consider a formal request in this regard. Again, my personal view is that we should also send a message of grateful thanks to those who have decided to postpone their visit until next year. I believe you will be doubly welcome then. This reduction in numbers should assist us to operate and open with as much safety as is possible, and we are doing much work in this regard. Council has voted unanimously to prioritise health considerations, and I am sure we will do all we can to keep these to the fore. The new engagement board will communicate fully with our islanders as we move forward. We really are all in this together, and community cohesion is pivotal. Thank you, Chairman.
Thank you. Councillor Guy.
Yeah, thank you, Chairman. Nothing to add on what has already been said, and keep up the good work. Thank you.
Thank you very much. Councillor Legg.
Thank you, Chairman. A couple of questions. One is relates to paragraph 37 of the report. Just finding that myself. It reads, in addition, the Islands Partnership has set up a business recovery task group in order to support business reopening, ensuring visitors are informed, and, the part that I'm interested in, that residents are comfortable with restarting the visitor economy. Could anyone confirm how the Islands Partnership will be testing whether residents are comfortable with restarting the visitor economy and what evidence they will be providing
Councillor Roger, would you like to comment on that?
Yes, this is a work in progress, Harry, so those things are still being worked out as such. The recovery cell is working hard on answering on lots of the concerns of the community, the particular one that the Chief Executive has already talked about in regard to the COVID presentation and what happens next, and the co-op, second on the agenda. So all those items are being dealt with, and through that process, and once we have the answers, I'm sure there aren't today from government, then the recovery cell Stroke Island Partnership can start to communicate onwards with the wider community to ensure that they are given the information that the rest of us will have to demonstrate that we can restart the economy safely, and that the wider community will be happy with that. No, it's not going to be a vote, but it will be communication on the information to demonstrate the effort and the resilience that's going into all of this, that the economy can start safely.
So just to confirm, you're saying that you aren't going to be ensuring that residents are comfortable, but you will be providing the information to enable residents to be comfortable.
Yeah, in a nutshell.
Yes, thank you. And then in Appendix C, the Scrutiny Committee recommendations, it notes that we will be accepting the evidence received from within the report of the Scrutiny Committee from June the 10th. I'd just like to read out some of that evidence and comment on it, if I may. The Isles of Scilly have a population of approximately 2,200 people. A fifth of people are aged over 70, and 30% of people aged under 70 have an underlying health condition. That would mean that 44% of the island's population are either aged over 70 or have an underlying health condition. This is a significant portion of the island's population, and I would be interested how this compares with figures on the mainland, although I appreciate that they may not be readily available. I just wanted to note that evidence that has been provided to us.
Thank you.
Chair. Thank you.
Thank you very much. Can we move on to Councillor Marcus, please?
Yeah, thank you very much. Yeah, no, it's a big report. Loads of stuff in there. It's really good that the council itself is adapting and just starting to deliver services within the restrictions and through the first details, and now a matter of public record. Got a question, I think, for Rachel. The whole track and trace thing that's going to have to happen to ensure that we know where infections are. How specifically, well, given that the government now are not continuing to develop their own app, and that they're going to have to, basically, we're going to have to wait to December for that to happen, which is one of the main pillars that they were going to use for their track and trace regime. How specifically is that going to work on the island when we're going to have potentially a massive transient population and throughout all of Cornwall as well? Could you sort of detail the specifics of how that is going to be implemented?
Yes, thanks for the question. So the track and trace scheme, as you know, is a national scheme. It kicks into action when someone has been tested positive. So clearly, it only sort of is implemented if people with symptoms seek a test, and I know that there's plans underway working to introduce some bespoke testing within the islands and expand that as we speak. So when someone is tested positive, they are then asked about who they may have been in contact with for over 15 minutes, in that 2 metres or less than the 2 metre distance. So that's the key issue, is who they've been in very close contact with for those 15 minutes. So, or more, obviously. So we're really looking, it's likely to be people they live with in their household contacts, or where they might have been, sort of spending significant time with a group or other people. So we'll note that being outside is much less risky. So it's clearly being in a contained space that has the higher risks, as we know, of transmission, because it's the respiratory droplets and airborne in the main part. And also, so they will be the people that will be contacted. So the person who's tested positive would need to provide some of that information. To the test and trace, they would then the phone call centre then follows that up with the people who they've been given the information on. So the Isle of Wight, that was seen to be not as nearly as important as the human contact of talking someone through, helping to jog their memory about where they might have been and things they've done that might lead to someone being a contact. That was the most important thing. And when I've done this myself with people working in the health protection unit, it's often going back to people's diaries, working through with them in the potentially pre-symptomatic phase, and that's the skill that's involved. And people doing this work, are being trained up, and many people are very skilled at doing that already. So I hope that explains a bit about how the test and trace works.
Thank you.
Thank you very much. And the other thing, Rachel, I think I misheard you in your intro. I had 494 cases. How many deaths so far on the Isle of Scilly? Sorry, Rachel.
So none for the Isle of Scilly.
Cornwall, yeah.
So those in Cornwall, and this is data that is from the Office for National Statistics, which is released every Tuesday. So I haven't got today's, I haven't looked through and had the analysis from today. But last Tuesday, up until the 5th of June, it was 203 deaths that had COVID-related causes.
Wow, 594 cases. So that's quite a high.
But obviously, as I think your Adrian Davis sort of referred to, the testing isn't obviously for everybody. So they are the ones that have been tested and tested positive. So obviously, not everyone sought testing. So that will be a proportion. So it's not accurate to create a mortality sort of rate, a death rate based on those two figures. Just to warn you.
Yeah. Okay. Good. Thank you.
Thank you, Councillor Mumford.
Yes, thank you, Chairman. Good morning, Rachel. Going back to the track and trace, which could be a bit of a problem here if you've got somebody who contacts the virus staying in a hotel or a bed and breakfast place where they've been in contact with all guests and staff. Could that cause that place to close altogether? Rachel, could you answer that question for me, please?
Thank you, Councillor Mumford. So clearly the social distancing arrangements within any types of accommodation will be important. So the definition of someone who's been in close contact is someone who's been within 2 metres for more than 15 minutes. So in a hospitality environment, that's more likely to be your close family contacts rather than other guests. But clearly there might be some research in terms of test and trace that they would do to ensure that wasn't the case, and that might involve some support from the setting. So these are all things that in the short term, if it's just one case, then that should be able to be managed and the person isolated. Obviously, we're having discussions about how that is done. awaiting further guidance. But in terms of the likely reopening of, I think it's pubs and cinemas in the future, this is clearly social distancing is the most important thing, and how that is put into place, along with all the messages around hygiene, hand washing, which is, of course, the most effective thing in preventing any of the transmission.
Well, thank you. As you might guess from the consultation, there's quite a lot of stress on the island in the community about opening up, especially for the vulnerable. Even when the government announced yesterday that vulnerable people would no longer have to isolate as from the 1st of August, I think if visitors, when they start coming in, a lot of vulnerable people here will be self-isolating and continue probably until the visitors go in the winter, which is going to be very hard on them, I think. I don't know if you've got any comment on that. I think it's also very frustrating the government don't give more information out, but I dare say we're going to get a lot of information tonight. Any comment?
No, I mean, just a reflection on how challenging it is, obviously, for people to be self-isolating, and I'm sure we all know people who, are having, cancer treatments or other reasons they're particularly vulnerable, and I know people are taking their own precautions, making their own decisions about risk, and that is what we all do in the face of many other different health risks as well, and our hearts go out to them for this, having to deal with the anxiety and stress in this situation. I think the key is the community support, whether that's not necessarily face-to-face, but where people are feeling that they're having to stay in, that they have that community engagement and community organisations and individuals who can offer that.
Thank you very much. That's all, Chairman. Thank you.
Thank you very much. Councillor Nellens.
Thank you, Chairman. Yes, Councillor Davis actually touched on part of my question about the two different types of testing for people who have the virus and then also people who have had the virus, and also what Councillor Mumford just touched on. But it's only a simple question. When people are tested, how long before the results are known on average for people perhaps who are living on the islands?
Hi there. Well, we're told that it's 72 hours, and I know that in the early stages of some of the testing, it wasn't as good as that. But I can't tell you the exact number on the basis of the Isles of Scilly, so it's something I can ask and come back to you on.
Yeah, thank you, because it will obviously have an impact here with sort of accommodation and obviously transport off the islands as well, which is going to be one of the major concerns for us here. But until it happens, obviously we can't take it anywhere. Thank you. Thank you.
Thank you. Councillor Roger.
No, I've got nothing further to add at this time. Thank you.
Thank you. Councillor Sims.
Yeah, hello. Firstly, with respect to Harry's numbers, and I thought, thank you for that, Harry. It's quite useful to get that 44%, but I think you can actually add to that the majority of our visitors are of a certain age. So we will have, if we have a lot of visitors here, we'll have a very, very vulnerable population, visitors and tourists. I have a question for Rachel. It looks pretty certain that the social distancing is now going to go down to 1 metre. I think we can anticipate that today. Now, I mean, certainly in most instances, when you're radiating something, you have the distance, then you square it. So at 1 metre, the infection rate looks to me like it should be 4 times greater than it will be at 2 metres.
Sorry, I wasn't sure. Was that a question or a statement?
It's a question. I mean, talking from 2 metres to 1 metre, which I think we are going to get, that would ramp up the possibility of infection considerably, I would have thought.
Well, there are risks to it, and there's a variety of studies that obviously show, sort of quite differing findings. It is a novel disease, and I think this is where we have to, assume that the government are being advised by the latest science. You'll know that lots of countries have different social distancing sort of recommendations. They vary from 1 metre to up to 2 metres. And clearly the important thing is that we have low current prevalence of the coronavirus in England and the UK, so that judgment has been made on the basis that it's less likely to be in the community, and that's why the government alert level was reduced from 4 to 3 as well. But clearly, in terms of infection control, then it would slightly, it would increase the risk. So I think yes, it could increase the risk. That's clearly a possibility too. We have to, keep the messages around hand hygiene and people that sit with symptoms, not, staying at home, and they're the two important things that have to work with that together. So we'll wait to hear what the government announces and their rationale for that later.
Yeah, I know, because it does look like the science behind the guidelines is sort of mysteriously morphed into 1 metre social distancing. And much closer, you'd get issues of public decency, I think. And I saw Hancock talking on Andrew Marr and about this specific thing, and he was talking about mitigations, and the main mitigation he was discussing was masks. And I would like, on that basis, to add an additional recommendation, which I have now lost. Yeah, but essentially, whilst I realise that we have, as an authority, no authority to insist on this, essentially that we have people, as Fran said earlier on, people wear masks in Q-Town and other crowded areas. Now, we have no actual authority to insist on this, but we did 2 years ago ask people to impose a hose-pipe ban without authority, and we asked people to save water without authority, and they certainly ran with it, and we saved lots of water and got out of a real mess. So I can't see any really good reason why we can't ask people to wear masks in crowded areas, because if we can ask them to save water, we can ask them to save lives. So I would like to recommend that masks are worn in Newtown and crowded areas and on the quay. That we ask, because obviously we can't insist.
Okay.
If that's a recommendation, I will second that.
Chairman, do you mean face coverings or face masks? I think that's an important differential we need to define. I think face coverings is the one that is recommended on public transport.
Whichever really. The more strident, the better, really. But this is an ask as opposed to an insistence, isn't it? So masks or face coverings will be fine. Yeah.
Okay. Well, when we come to the recommendations, I will add that in. But first of all, can we just have, please, a vote on that particular recommendation, which has been proposed by Councillor Sims, seconded by Councillor Legg, that we ask for face coverings to be worn in the proximity of Q-Town. Are there any members?
Chairman.
And other crowded areas, particularly the quay.
Chairman.
Okay, well, we'll obviously have to work on this and define that.
Yeah, that's
but in principle, are there any members against that recommendation, please?
Yes, Councillor Roger.
Any other members against?
Well, yeah, Robert Dorian Smith. I think it's pointless. I'm not against it. I just don't think there's any purpose to it.
Chairman,
the outdoors is not a big issue in any case.
Yes, monitoring officer.
Yes, could Councillor Sim just email me the actual suggested amendment so that we can perhaps come back to it when time permits, so that members can have a think about it during the debate before we take the final vote.
Yeah,
okay. Thank you very much.
Chairman, may I say something?
From you, Councillor Sims.
Yes, just one thing. I just wanted to emphasise the second resolution for the scrutiny committee. I just wanted to emphasise it because it's really, really important. It's just the last part of it. The islands need will need particular bespoke recovery systems in place above and beyond the mainland in order to open up confidently and safely. I just wanted to emphasise that again, but that's essentially all from me.
Thank you. Councillor Smith.
Thank you, Chairman. Thanks, everyone, for a very good report here. Just wanted to touch on a couple of health issues. This is sort of following on from some scrutiny issues that we didn't get to ask you, Rachel, at the time. Just regarding the modelling cell, there was going to be some modelling regarding the return of tourists. Can you tell us any more about that work at the moment?
Hi, thank you for that. No, actually, since that note was written, I was asking, we've had Kerry Bailey working with Exeter University on modelling for the whole of Cornwall, and she's not been in work for the last month. So unfortunately, the work that she was doing, I had to then go and talk to the Exeter team. So it's not, so modelling at such a small area level is not possible in terms of the estimates of what could happen. Modelling is all based on a lot of assumptions. And, even at a whole Cornwall level, there's huge variations in the different scenarios. But that is something that they are working on for the whole of Cornwall to inform internal planning. And it's based on possible future scenarios and projections. But it isn't, it isn't for the Isles of Scilly specifically. So that's just an update on that.
Okay, thank you. And just another one for you. In terms of as touched on by a couple of my colleagues, anxiety amongst some vulnerable people, and you make some notes there regarding communications. Can you just confirm who is leading on communications in terms of messaging for people and some reassurance? Because I think that's really, really important in this scenario.
Yeah, so in terms of our sort of whole area of Crossley Cornwall and Isles of Scilly communications, I know that we have been doing regular media briefings that I've attended every single one since beginning of the pandemic, and that is attended by media from the Isles of Scilly as well. So there's been a regular media sort of channel and a briefing going on weekly. But I understand that the role of the local outbreak engagement board, which Paul discussed and talked about the membership, that is the expectation is that will provide the local point of contact for sharing further information, and that communication strategy essentially will fit with that board for the next phase. I don't know if Paul wants to add anything on that.
Yes, absolutely. If I may, Chairman, a couple of things. I've been trying to come in. Sorry, it's difficult, on the telephone. Could I start? Yeah, Rick is absolutely right. The whole reason for the engagement board being set up is to try and offer a single route of communications to our community, to give them confidence and to try to either answer their questions or to seek answers where we don't know the answers. So that absolutely is its key role, and that's why I'm very keen that we set it up as soon as possible. Could I just also mention, before members get to the vote, on the recommendation that Stephen will lay out? I just wanted to advise members that in terms of the balance with giving community confidence and about the risk, should also be in line with government guidance, in my view. And there's a lot in there today, particularly about the summer season, that Rachel might want to make comment on, about the outside risk being very, very low, particularly in the summer, because of the temperature and sunlight. There's an awful lot in the paper about that today. And therefore, in terms of wearing masks in the high street, I would recommend that if you're going to do it at all, it should be along the lines of something in order to give people confidence that visitors should consider wearing face coverings in crowded places. I'm just trying to get the balance between community support and welcoming visitors, Chairman.
Thank you very much. A very good point. Thank you, Paul.
Chairman, it's Marion here.
Thank you, Marion.
Hello.
Yes.
Can I just come in and emphasise the point about having a single point of contact? Because at a Briar Island meeting on Saturday, this was one of the main requirements, that we knew who to contact. I don't even know who the single point of contact is on the council. And as the only local councillor, that's a pretty poor state of affairs.
Okay. Paul, would you like to comment on that, please?
Yes, I think we need to be careful here, Chairman. It is not the role of the council to give everybody answers to everything that they want to know. It is our role to try and work with partners in order to ensure that wherever we can get answers to questions, we will seek to communicate them as widely as possible. There have been daily communications from the council. Whether people have got them in the right venues or not, obviously we can always improve. But in terms of the amount of communication that's gone out from the council about Q&As, what's happening in services, where to get further advice, signposting to government advice, that has been on the website almost, to my knowledge, every single day. But that is absolutely the role of the Engagement Board Chairman, and I'm sure you will want to be seen to be much more active in holding us as partner officers, because it's not just the council, it's all parts of the public sector and business community, in giving confidence to residents that the business community is in compliance with the laws that will be announced probably today by the government, and our role to disseminate that. But it is not the council's role to be solving absolutely every single issue, or to have a 24/7 helpline. We're here to deal with enforcing the rules, disseminating the information, and lobbying on behalf of our businesses and our community for clarity where we can get it.
Thank you very much.
Thank you for that.
I have had a letter from you, Councillor Barclay, with regard to that, and obviously I'm dealing with that as I replied to you. So I will give you further information in due course. And obviously, the Chief Executive said, I think once we get this engagement board set up, having our first sort of look at that tomorrow, as soon as that is set up, that will help with communications hugely. Thank you.
Chairman, could I just make a comment on the face mask issue, just to sort of reiterate the guidance around use of them and the lower risk in outdoor environments? It is, I know that the UK was late on sort of coming into the guidance on this, but just in terms of sorry, my dog's going. The risks about using face masks again, or face coverings, as we should refer them to them, is that if you notice people do fiddle with them quite a lot, putting them on, pulling them off, especially if they were to be advised to wear them in certain places in the islands and not others, they'd be putting them on and off. So each time that would require hand washing, and frequent washing of those face coverings as well for them to be effective. So whilst there's there's on the one hand that sort of security of potentially reducing someone with the virus from spreading it by containing it in a face mask, there's also the other risks if the hand hygiene and other things aren't put into place. So on balance, you need to consider both of those things. So I just wanted to add that.
Thank you very much, Rachel. Councillor Smith, had you finished your comments, please?
No, sorry, I had another question for Rachel, just regarding, there's been some discussion around local lockdowns in the case of outbreaks. This has been discussed by government. Do you know what the triggers would be for that and what the measures would look like?
Hi, so this is a question that's come up a number of times, and currently there's no powers for local authorities to implement that sort of lockdown, or being there's no guidance that outlines how those powers would work. So at the moment, the sort of words that we've heard is that the local engagement board would have the line to ministers for discussion around local action. So that's the only thing that I've seen. So currently there aren't powers to do that and I'm talking in Cornwall, so obviously there might be different issues in the Isles of Scilly. I don't know if Paul can add anything to that, but it's not clear, I think, is the summary.
Right.
Yes, I can, Chairman. I also advised members at the informal the other day that I was on the national call with Tom Reardon, who's the national lead on outbreak planning as part of the Chief Executive of Leeds, and is working alongside the Government and Public Health England and the Joint Biosecurity Centre in terms of outbreak planning. And he made very clear to all chief executives on that call that in terms of lockdowns, be it national or local, they would be the very, very, very last thing to be considered. There would be many other measures in terms of local track and trace, encouraging communities to change behaviours, etc. So lockdowns are very unlikely, if at all.
Thank you for that. Just last question, please, just regarding isolation of tourists. We who are showing symptoms. We've discussed this a lot. I'd like to emphasise that I think this is absolutely critical for us to be able to continue. And I'm picking up a huge amount of concern in my community here. So just really a question of urgency, and when do we think we're actually going to come up with a collective solution, please?
Paul, do you want to answer that? Or?
Yeah, well, I mean, I think there are obviously, the two issues, isn't there? There's the issue about, at the moment, do people isolate and all the issues that causes on the islands in terms of bookings coming in, and do we find alternative accommodation? All those sorts of discussions are currently ongoing. And similarly, even this morning and last night, I was in conversation with all of the transport operators about alternatives in terms of transporting people off the islands. And also, I need to have discussions with Rachel about that as well. So I'm hoping days rather than weeks, in order that we can come up with a local solution that fits with everybody's needs. But we're doing that in spite of lack of guidance, in order to try and see whether we can come to our own solutions as well. So please take it that this is absolutely understood to be the key issue that is outstanding for the islands, and we're all working as hard as we can to come up with a possible solution.
No, thank you, Paul. Appreciate that, but also would reiterate that I think it's actually almost beyond the risk assessment of any business to open until we have that solution, I would argue.
Well, absolutely, I understand that. I mean, interestingly, it's similar. You could argue exactly on the mainland, because if you come by train to Penzance, you haven't got a car to go home. So I think this is not. I know it's exemplified on the islands. So please don't take that the wrong way. But that's why I'm trying to make this a national question, which has gone, as I said, to two ministers yesterday, because it is the key stumbling point that we need to clarify.
Thank you. Thank you, Chairman. Can I just come in here, Councillor Roger? Chief Executive and Jonathan. On our recovery cell meeting on Friday, Derek Thomas did give us an undertaking that this single issue, he would personally see through to government, and I'm sure through Paul as well, that he's on it. Okay.
Thank you very much.
And Councillor Rogers, have you a personal interest to declare on this that you wish to have recorded?
Assumingly it's come up through this meeting that I should have declared an interest as Director of the Islands Partnership, so I hereby declare that. It's non-pecuniary, so I don't intend to leave the meeting at any stage.
Okay. Councillor Watt?
Thank you, Chairman. Just to go briefly back to Harry Legg's comment on paragraph 37, namely the phrase visitors are informed and that residents are comfortable with restarting the island economy. I appreciate what you and Rogers said about this being a work in progress. I just want a bit of reassurance, really, that the IP and the Council are sending the same message at various times and on communications to avoid any confusions.
Thank you very much, Councillor Watt. Councillor Williams?
Thank you, Chairman. Yes, I've got two questions, one for Rachel and one for Nicholas Paul. And the first one was around the outbreak plans, which is aimed at Rachel. And you suggested it's going to be a joint plan with Cornwall and Scilly. In the past, when there's been joint plans, we've often found that Cornwall gets 95% of the narrative and Scilly is sort of tagged on to the sort of back end of a paragraph somewhere. Could you give some reassurances that when we're talking about high-risk places, that Scilly will be adequately, sufficiently included in depth for how we deal with those outbreaks, please?
Thank you. Yes, I mean, that's certainly the intention. Obviously, a lot of the public health resources are within Cornwall in terms of our team, and we will be supporting the Isles of Scilly with our team. So you don't have that public health presence. So, it makes sense to have a collaborative approach, but we need to absolutely clearly have the Isles of Scilly as a setting, and we've been working with your emergency planning leads to do that.
Okay, thank you. And my second question was for Nicholas Paul, and that's relating to the High Street Fund in bullet 40 of the report. I don't think we've touched on it yet in our discussions this morning, but the narrative again suggests that St Mary's are going to get the majority of the High Street Fund and the majority of the thinking and how that's spent. I'd just like to make sure that I'm going to champion off-island shops. I know from hardship conversations that the High Street on each of the respective off-islands is as important to them as it is in St Mary's. So I'd just like to make sure that they aren't forgotten when discussing High Street Fund allocations, please.
It's Nicola. Yeah, that's noted. I think we can circulate what's eligible. It's quite restrictive, the conditions around the funding, but certainly it could be used on the off-islands if the criteria were met. So happy to have any discussions with off-island members if they feel they would want to access that fund.
Thank you very much.
Thank you. I would just like to, before we go to the vote on the recommendations, in view of the further recommendation that has been proposed and seconding, Chief Executive and Rachel, could I just ask you, in view of the fact that we have to go by government guidelines, would it be sensible to suggest that actually we don't have this as a recommendation at the moment, but that we look at how we could deal with this and see whether or not there's a way of working within government guidelines that we can, that we can perhaps suggest to people that in crowded spaces that they consider wearing face coverings. I mean, how would you suggest we deal with this, or do you want us to take this recommendation as it stands?
Well, Chairman, obviously it's not for me to impose my view on members. That's for members. But all I was trying to say was that we totally understand that the issue that I think councillors were trying to raise here about giving both residents confidence that all due measures have been taken in order that the islands remain safe, as well as balancing that against welcoming to tourists, is a key point. And therefore, there are a number of issues that you might wish to consider in the recommendation. The first, as I said, is that as far as I can see, people outdoors, the risks are much lower anyway, as Rachel's just discussed, and there's a lot about that in the paper today. But whether or not members ask us to come back with a draft of a public message that will be put on the boat or in the airport, that in effect give people advice about how to behave on the islands, and that is seen and agreed with members. Whether that's a sort of a compromise that would be agreed by all, that would be for you. But I'd rather work that up carefully with public health colleagues rather than jumping to a recommendation. But obviously that's for members to decide.
Yeah. Chairman, it's Fran Grottick here. May I add a word, please?
Yes. Yes.
Professor Pyatt, who was on the Andrew Marr show the other day, is a biologist, and he commented that there are obviously, as we all know, asymptomatic carriers, and he would prefer to be at 1 metre distance with two people wearing masks than at 2 metre distances without. So obviously the whole subject is currently being discussed. But one of the reasons that I would support that recommendation is to guard against complacency. That, I would argue, is one of our key dangers, because I've had several accommodation providers who are trying to be honest to prospective visitors and explain that their holiday will of necessity be a very different experience. And I think that is good that they are honest. And people are very surprised. Oh, but you haven't got COVID over there, so we thought you would just be operating as normal. And the advice, and it is only advice, that in crowded places we would like people to seriously consider wearing a mask, is really to remind people that we have to be as careful over here as in any other area of the United Kingdom, and possibly more so, because we have had no chance to build up any immunity. Thank you.
Thank you, Councillor Grottick. Thank you, Chief Executive, for your comments. I fully realise it's a member's decision, but I just wanted to get guidance basically around whether we should be trying to make recommendations that may not be government guidance. We don't know yet, and how we would possibly enforce that. But Anyway,
Robert, may I come in again?
Yes, of course, Councillor Sims.
I completely agree. We can enforce it, but that's not the point. There are people all over the country now. You see, every time you see TV pictures, people walking around high streets with masks on. But nobody's insisting they do it. But it emphasises the fact that it potentially will be here, and people are aware of it. I completely run with what Fran just said regarding complacency. We can't insist on it. It's not an edict. It's just an ask, like it was with water. Please save water. So this is please save lives, and I think we should do it. I've been to and from with Stephen, and I think I've come with what I like anyway, and hopefully Stephen will like it as well.
I suggested a final version for you.
Yeah, I know. I've just modified that.
Okay.
The council asks both visitors and locals to respect government guidelines in relation to the wearing of masks or face coverings outside the home, in local shops and in crowded areas. And that would be my recommendation. And I think we should put it through because it's an advisory, it's not an order.
Seems fine to me.
Thank you.
Okay. Yeah, fine by me as well with those final words, because I think the important thing was to take out the reference to Hugh Town, but certainly I'm content with the others. Should members feel that that's a useful peg to hang communications on?
I would still be happy to second that.
Okay, thank you. So in view of that amended recommendation, are there any members against that recommendation, please?
So I still want Councillor Rogers to remain against it. I think we should await the government guidance and then look at it again in that context.
As was said, if I can read it out again just so that it captures it. The Council asks both visitors and locals to respect government guidance in relation to the wearing of masks or face coverings outside the home, in local shops and in crowded areas.
Okay,
thank
you.
I'd missed the government guidance, so I'm okay with that now.
Thank you.
Okay, thank you. Are there any other comments from members on this, please, either against or abstentions? No, then that recommendation is included as well. Thank you. So we have 11 other recommendations, so we have 12 in total. You have them in front of you, so I don't intend to read them all out. Could I have a proposer for all 12 recommendations, please?
Chairman, can I just ask a question about recommendation 11?
Yes, of course, Councillor Marcus.
The local outbreak plan is going to be the chairman, vice chair and the chair of the Health and Wellbeing Board. But recommendation 11 states that the lead member for place will be authorised to endorse the local outbreak plan. Why have we got that two different people doing that?
Chief Executive, would you like to comment, please?
Yeah, I'll do my best, Chairman. Of course, in some ways we're ahead of the guidance on this. So the issue of the outbreak board, the Cornwall and Ulster City Outbreak Board I'm talking about now, which is chaired by Rachel Wigglesworth, is to produce the outbreak plan of those 7 themes as I talked about, and is linked very much to our emergency and management approaches, which is why the lead member for place was particularly mentioned because of the role of emergency management. In terms of the engagement board, which is chaired by yourself, Chairman, about communications, the reason the chairman of the Health and Wellbeing Board was mentioned on that one is that's the only sketchy bit of guidance that has come from government, is that it's expected to be politically led by either the leader or chairman of the council, and with a direct link to Health and Wellbeing Boards via the chairman of the Health and Wellbeing Board. So that's why, but as I said, members, the guidance on this is sketchy at best, and we're just cracking on and doing it.
Councillor Marcus, are you happy?
That's fine. Yes, that's good. Thank you.
Chairman, may I just come in again?
Yes, certainly, Councillor Legg.
With respect to
Proposal 7, Recommendation 7. The report also mentions having an off-island representative on the local outbreak engagement board. We haven't actually discussed whether we would like an off-island representative and who that may be. Did we want to discuss that?
Well, I've actually already put forward, although it hasn't been agreed yet, but the matter was brought up by Councillor Barclay, who asked if they could have off-island representation, and therefore tentatively I have asked Councillor Barclay, in view of that, if she would like to join that board, and she has indicated that she would. However, if any member is not happy with that arrangement, we're not actually voting people onto this board. I'm working with the Chief Executive to pull the board together, but if any member is not happy with that arrangement, that Councillor Barclay would actually represent the off-islands, then please come forward with another recommendation, please.
Can I add to that, Chairman? The reason why the recommendation is worded as it is precisely, as the Chief Executive has said, is that there is a lack of definitive guidance on this. And so in paragraph 27, off-island member representative is mentioned. And also, so far as the recommendation itself is concerned, it talks about core members. That does not prevent other members attending when there are matters of interest relating either to the general discussion or to their particular interest on it. So we have tried to keep it as vague as possible. In view of the lack of definitive guidance, and that can be firmed up at the next meeting. But in the meantime, there is a core group. It will be established by members, assuming that they vote for recommendation 7, and the terms of reference are as set out in the report at paragraph 22.
Councillor Legg, I would like to mention just from the chair that I fully appreciate that all off-islands in Scilly are different, and that there are different requirements and needs from each off-island. And I would hope that the off-island representative would feed into the board any concerns from any other off-island councillor, if that is acceptable to you.
Chairman, could I come in, please, Councillor Mumford?
Yes, of course.
Yes, I would like to actually propose Councillor Legg to sit on this board.
Okay.
I would happily second that. Steve.
Okay. Right, so are there any other nominations, please, for off-island representative?
Chairman, I think what Stephen was saying was that the paper is deliberately vague, so we don't have to do this at this current time. Gives us a bit of time to see what the, like Paul said, see what the guidance is, and then we can make adjustments to that membership. At the moment, it's only just the key members on there, isn't it? So, not that all members are key, obviously. So maybe nominations aren't really valid at the moment.
No. Thank you very much, Councillor Marcus. If members are happy, we will deal with this matter outside of council.
Yeah, I would support that, Chairman, Councillor Groshek.
Thank you. So, could we please go back? I'm still waiting a proposer, please, for all 12 recommendations.
Robert, before I'm happy to propose all 12. Steve here. There's no mention of a rep from the steamship company on that board, and I would have thought that was essential. They're just mentioning that. I'm sure it'll sort itself out in the fullness of time.
Yeah.
And again, they can attend, Chairman, certainly, but the important thing is to get the board established with the core membership, and then the detail can be worked in.
Can I just make clear to members as well that, as I said in my introduction, that the engagement board would link to what we used to call OPIC, that has got transport operators on it, the police, the RNLI, the Coast Guard, Chris Pickin. So there would be a link to that board as well, in making sure that all public sector partners are also linked to the board rather than sitting on it. I was just trying to manage the numbers.
Chairman, could I come in, please? Councillor Mumford.
Thank you.
I think we've had a proposal and a seconder. I'd like to ask the monitoring officer, do we not have to take a vote?
It depends whether members wish to or whether they accept what the chairman has said and the advice that's been given. If the amendment is if the mover of the amendment is determined for it to go ahead, then of course there will be a vote. Yeah.
So, what's the situation, please? Could the proposer please say whether they are happy to have this matter sorted outside of council, or whether you want this recommendation to be put forward?
No, I'm not happy for it to be discussed outside. I would rather it be discussed in council if the other members are in agreement. I think Councillor Sims was my seconder. What do you feel?
As seconder, I completely agree, Al. I mean, this is. If we are having an off-island representative, then there's no reason why we can't decide who that off-island representative is at this point, because there will be one anyway.
I agree.
But we don't even know if we're having an off-island representative yet.
However, if we are, then we've spoken to the person who it will be if there is an off-island representative. So it expedites the process.
Monitoring officer, what do you feel about this, please?
Well, there has been an amendment put forward that Councillor Legg be appointed as the off-island representative, and if members wish to approve that amendment, then he will be added as a member of the local engagement board.
Okay.
So go to the vote.
Yeah, well, I will decide with the chief executive whether or not we have another off-island member if Councillor Barclay still wishes to be on there. But I'm happy to take the amendment. We need to get on with this now. So could I please have anybody?
Chair, I think Councillor Barclay was trying to chip in, unless I didn't hear.
Yes, I was. I'm very happy for Councillor Legg to take this role on. I think whoever the off-island representative is, the off-islands will insist on being represented well and to recognise the differences between the different islands and their different requirements. So I'm very happy to stand aside and support Councillor Legg in that role.
I think that's very gracious, Councillor Barclay.
Okay, thank you very much. So, are there any members against the appointment of Councillor Legg as the off-island representative on the board? No, then that's confirmed. Thank you. So can we still go back, please, to the 12 recommendations? Could I please have a proposer for these recommendations?
Yeah, I'll propose them.
Councillor Marcus.
I'll second that,
please.
Mumford.
Councillor Mumford. Any member against the 12 recommendations? Then they're carried. Thank you very much indeed. And I'd like to take this opportunity to thank very much indeed Rachel Wigglesworth for joining us today and helping us with this very important paper. And I would also like to thank the staff of the Council for their considerable amount of work that they have done on what is an excellent paper. So thank you very much indeed. Right, we now move on to the planning items on the agenda. it was number 8. It's now number 9, Racket Town Bungalow, and this is in the hands of our Senior Officer of Planning, Lisa Walton. Thank you.
Chairman, this is Robert Dorian-Smith. I'm leaving the meeting.
Thank you.
And Councillor Nellams?
Can I assume he's left?
Thank you. Yes, Lisa, thank you.
Yeah. Good. Thank you, Chair. Good morning, members. So we've got an application that's been brought to you because it is an application by an elected member of this council. So this is an application for improvements and extensions to this existing dwelling on Tresco. The property is owned by Tresco Estate and is a single-storey bungalow that is a conversion of an older agricultural building. It stands separate from the built-up parts of the island and is set inland for around 250 metres in from the coast. The proposal includes the general improvements to the appearance and energy efficiency of the property, as well as demolition of an older extension and replacement with a larger modern extension. There's certainly more traditional in appearance. As part of the proposal is a single-storey outbuilding that will provide a golf buggy storage parking area, as well as a studio facility. To the front is proposed to construct a swimming pool. Following assessment of the submitted plans and the documents, assessment of the site, no aspects of harm were identified in terms of the visual impact. The proposal makes improvements to the energy efficiency and the accessibility of the building, and whilst there will be a greater usage of water, this replaces a removed public pool from the new inn earlier this year. The pool will be heated through solar PV panels, and as such, the impact overall is considered to be acceptable. Overall, the property is a holiday-let dwelling on the island of Tresco that will provide disability-friendly accommodation, and in light of the positive improvements proposed both in terms of its appearance and efficiency, the neutral impact upon water usage and general biodiversity enhancements to the site has been assessed as acceptable. The proposal is recommended for approval subject to the submission of, we're awaiting some BAT emergent surveys and the conditions set out in this report. Thank you. Has anyone got any questions?
Apologies, Lisa. Councillor Marcus, would you like to comment, please?
Yeah, okay. Thank you, Lisa, for the report. I don't think... I've just got questions about the actual the swimming pool aspect of the plan, really. Both Surface Water commented on the plan saying there was neutral impact, and the planning design statement says that Tresco has both ample supplies of water and electricity, which goes against what we've been told and what we've been telling the community, that our supplies of water are fragile. I understand that they've got rid of a swimming pool at the new inn, but adding another, replacing that isn't a neutral impact, it's just going back to where they were. Lisa or Nicola, do you want to comment on the water supplies? Have Tresco got ample supplies, or are we in fact in this together and have precious supplies of water that we need to protect?
I mean, obviously the supplies on Tresco are their own supplies of water. I have no information from any source that suggests the islands can't manage an additional swimming pool, so I have to conclude that they've got rid of one pool and they're putting in another pool. It will have, they would balance each other out. They were previously operating a pool, they've got rid of that pool. That water supply to that pool is now going to this pool. So I've got no information that would suggest it would pose a problem for the water supplies on the island of Tresco. As South West Water have taken over the water supplies, they have not put forward an objection on which we would base the refusal for this application.
Okay, well, it's just obviously confused because what we've been told in the past is that there is one water supply that links between the islands, but there is no, I can't see anything to, any grounds to refuse the application, so I would propose a recommendation. That's it from me, Chairman.
Thank
I'll
you.
second that.
Are there any other comments, please, from members?
Councillor Mumford here. Could I just ask a question, please?
Thank you.
Lisa, paragraph 28, it says, as submitted to the Secretary of State Policy LC9, whilst it sets a minimum standard, does not currently set a maximum standard. Does that mean that there will be a maximum standard later on? Because then it says the proposal is therefore currently within the requirements.
Yeah. So currently, the emphasis, the intention behind Policy LC9 was to ensure existing homes we will permit extensions, providing they're within the range of the minimum standard. So, 2-story, 3 bedrooms. It depends on how many people are living there as to the range of which that property would be permitted to be extended to. The as worded policy, and this was picked up at the examination, probably by the inspector, he said, I don't think your policy captures the intention. I understand the intention as you don't want homes to be too large, as well as we don't want homes to be too pokey and small. So I would suggest you set a maximum. So the as worded submitted policy doesn't expressly set a maximum standard. So currently, in this application and on all applications that have come before us, are within that policy threshold if they meet the minimum standards. The modification to the plan that will go back to the inspector proposes to set a maximum standard at, and I think it's 30%, but I can't remember. But that would be subject to public consultation.
Right, so it is possible that actually if there was a maximum and it was over the maximum, this would have gone to refusal.
Well, potentially, but also I've got to bear in mind that we're also dealing with this as a unit of tourist accommodation. So we have tourism accommodation policies which talk about improvements to the quality and offer, and so there is also a life. If someone is coming to us, a business operator with an existing holiday let, and they want to make it larger, and they make a good case as to why it should be larger. In this case, it's to do with improvements to accessibility standards of the property as well as energy efficiency. It wouldn't necessarily be a refusal if it was eking over the edge of the maximum. No.
Okay, thank you. Thank you, Chairman.
Thank you. Are there any other comments, please, from members?
Yeah, Councillor Smith here. I'd just like to back up the comments made by Councillor Mumford there. In relation to paragraph 28, I think it's disappointing that this is recommended for approval when it's going against the intention policy LC9. Though I understand the reasons why refusal can't be given on those grounds. Policy SS2 and our emerging local plan said it makes efficient use of land. I mean, I don't think it's going to be ready regarded as an efficient use of land. It's very expensive. Particularly disappointed in letters from 21st of March from Nick Lowe, their architect, saying that this property is at a distance from central facilities. That's just not true. It's less than 5 minutes walk to the stores, the Flying Foot Club, the pool, a beach. And so I really don't think this is a fair justification of a swimming pool. And therefore, I'll vote against this proposal.
Thank you. Are there any other comments, please, from members?
I'm happy, Marion here. I'm happy to second the proposal, which I think was made by Dan Marcus, to approve the plan.
That's correct. Just checking whether or not there were any other comments. So, in absence of any other comments, we have proposal. Councillor Marcus, seconded by Councillor Barclay. We have one person, Councillor Smith, against. Are there any other persons against the granting of permission for this application, please? No, then the application is granted. Thank you. The next item 10 on the agenda is the application for Tregarthen's Hotel, again in the hands of Lisa. Thank you.
Thank you, Chair. So this is a Section 73 application that seeks to implement an approved development not in accordance with the approved conditions. Specifically, the applicant is seeking to vary condition C19, which restricts construction works to the off-season and permits no work to take place during April through to September. The application is brought to full council on the basis it's been called in for a decision by the lead member for planning due to the potential impact the variation as requested could have on neighbouring properties and businesses.
Can I just interrupt, Lisa? I do apologise. Is it possible just to confirm that Councillor Dorian Smith and Councillor Nellams have been invited back so that they're able to take part in this discussion?
I see. Then, I'll just confirm I have contact from them both by email and by mobile in the last moment or two.
Thanks. Apologies, Lisa. I do apologise.
No worries.
Thank you.
Can they confirm they're both here? Or?
Councillor Dorian Smith, are you in attendance again, please? Councillor Nellams, are you in attendance?
I can hang on, or I can.
Okay, but Andy Thomas, you have contacted both of them, have you?
Thank you, Robert. I'm back.
Oh, yes, thank you, Councillor Nellams.
I'm back, Robert.
Okay. Thank you very much, Councillor Dorian Smith. Please continue, Lisa.
Yeah.
Thank you.
Thank you. Just to quickly recap, that's a Section 73 application that seeks to implement an approved development not in accordance with the approved conditions, and it's been called in due to the potential impact this requested variation could have on neighbouring properties and businesses. So officers have, this is Tregarthen's, officers have considered the reasonableness of the request to remove seasonal restrictions completely and do not consider it appropriate to permit all works to take place at any time of year. The basis of the seasonal restriction is in relation to the scale of the works applied for in 2018, the complex nature of the site and the impact all of this work could have on immediate vicinity and the wider economy in the absence of a clear schedule of works. In relation to this current application, consideration has been given to the impact of the current pandemic on businesses, but also the unique opportunity it presents to undertake maintenance and construction works at this time. The government is positive about not placing unnecessary restrictions in the way of construction projects and ensuring projects can get underway at the earliest opportunity. The applicant references a written ministerial statement to that effect, which is linked in the report, and that encourages local authorities to take a swift and positive approach to requests from developers and site operators for greater flexibility around construction site working hours. Where developers require longer-term or more significant changes to working hours, they should apply to the local authority, which is the case here. So whilst the applicant is not seeking to increase working hours on a daily basis, they are seeking to facilitate completion of the project, which they state is restricted considerably by not being able to undertake any aspect at all from April to September in any year. So although a complete removal of the timing aspect of condition C19 without a clear schedule of works has been considered unacceptable, in order to seek a balance between enabling the development to take place while protecting the wider amenity of the islands, it is recommended that those elements listed could reasonably be undertaken without significant adverse harm and could take place throughout the year, providing the elements listed in the second part of the condition are scheduled to take place outside the peak tourism season months. So all works must abide by the considered construction practices as set out in the construction management plan for the site. And subject to this, the recommendation is that condition C19 be varied as set out. And this is all subject to a formal deed of variation being signed. The deed of variation is in relation to Section 106 unilateral undertaking that the applicant entered into to not implement parts of an earlier 2016 permission. So a number of representations have been made in relation to this application, particularly concerns about the impact it could have on other businesses, the impact of noise affecting other businesses, just at a time when many people seek to make make up for the islands being closed for the first half of the year. Officers are aware that this is of a concern, but on the basis that construction is a short-term impact relative to the wider and more long-term improvements to this site, the variation to condition C19, as set out in the recommendation, will ensure the works can be completed sooner, which is in the wider economic interest of the islands. The recommended variation to the condition would enable some of the works to continue, but would restrict the larger scale aspects of the development to take place during the off-season, when the impact upon the economy would be lower. And that's it. If you have any questions, thank you.
Thank you. Councillor Marcus?
Yes, thank you. I think this is a really good example of working with the applicants and trying to come up with a compromise that is beneficial for all parties. What we do want to do is prioritise a single business over the wider economy. We had visions of businesses trying to open up and staff being a prominent site, being a building site which would be noisy and not projecting the best image out to our visitors at the time. I think it's a sensible negotiation to preserve the unique beauty of the islands for all visitors, balancing the needs of an individual, a single business, but prominent business. So, therefore, I propose a recommendation.
Chairman, can I say something? Councillor Brossett?
Thank you.
Just two quick things. Firstly, I'd like to remind members of the original condition that was put on this application when it first came to council, is that these properties remain as part of the hotel complex and cannot be sold off separately. Secondly, I'd just like to quickly ask Lisa, have you the resource, if we agreed, as you suggest, to monitor the allowed differences that you have suggested in the variation?
Well, as with any application, we do rely on the applicants abiding by the conditions, and there is an expectation that if they are going beyond what this condition permits and undertaking the specific aspects of work during the summer season when they're not meant to, we will be informed and we would write to them.
I was thinking about the noise aspects, and then, it's a balancing act, isn't it? We have neighbours who are in the tourism industry and they're worried about the noise. Obviously, they can make a noise complaint, but this takes time if there was an issue. I just wondered if we were going to proactively work with the applicant to make sure that, we tried to minimise the disturbance adjacent businesses.
Yeah, I mean, the construction management plan sets out, they will endeavour to let their neighbours know when they're going to be particularly noisy and where to complain to if they are suffering, and hopefully that will be fed through to the council where necessary, and we can get in touch with them and let them know they are causing a disturbance. There is also the fallback position, which we don't want to be in that position, but the statutory news nuisance under the environmental health colleagues could also go down that road. The reason for this condition in the first place is so we don't have to be in that position.
Understood. Thank you.
Thank you. Are there any other comments from members, please?
Yeah, Chair, I just wanted to echo Councillor Marcus's comments and welcome the flexible nature of the planning department.
Thank you. So we have a proposer for these recommendations that are in front of you. Could I have a seconder, please?
Yes, I second that, Councillor Mumford.
Thank you. So the recommendations are proposed by Councillor Marcus, seconded by Councillor Mumford. Is there anybody against the recommendations, please? Then they're carried. Thank you very much indeed. Item 11 on the agenda now is the appointment of monitoring officer, and that's in the hands of our Chief Executive, Paul Masters. Thank you.
Thank you, Chairman. Members will be aware that under the agreement with Cornwall Council for the provision of monitoring officer support, the current monitoring officer, Matt Stokes, has recently been promoted within Cornwall Council and therefore feels that he needed to stand down from the role. And therefore, in line with the agreement, the Cornwall Council put forward a nomination for us to consider. A panel was formed. That panel interviewed the nominee, which was Simon Mansell, and the panel's recommendations are before Council, Chairman. I have nothing further to add.
Thank you. Sorry, it take me a while to come off mute again. Have any members got any comments on this paper, please?
Is Councillor Mumford here?
Thank you.
I would like to propose the recommendation.
Thank you. Do I have a seconder, please, for the recommendation?
Yeah, happy to second this, Councillor Dean.
Thank you, Councillor Dean. Are there any members against the recommendation that is set out in front of you, please? No, then that recommendation is carried. Thank you very much. Item 12 now on the agenda is the appointment to Scrutiny Committee. This is in the hands of our Policy and Scrutiny Officer, Bob Dawson. Thank you.
Thank you, Chairman. First, may I pass on thanks from the Chairman of the committee, Councillor Mumford, to Councillor Dorian Smith for his time on the committee since 2017. Next, I will take the report as read and therefore open the discussion to members for nominations and appointment under any additional guidance from the Council's monitoring officer. Thank you.
Is Councillor Mumford here?
Councillor Mumford.
I would like to propose Councillor Williams, please.
Thank you.
Councillor Smith, I'd like to second that.
Thank you. So I have a proposer and a seconder for Councillor Williams. Are there any other nominations, please?
Councillor Sims here. I'm happy to support Councillor Williams on this. But just for clarification for myself, previously, when we've appointed members to committees in previous years, it's generally we've gone. It's been a bit of a waste of time, I must admit, but we've gone right round, and everybody has had to be put onto the committee by full council, as opposed to the continuation we seem to have now. Now, I'm quite happy with the continuation, but is that actually the correct way of doing it? It's a question for Stephen, really.
Stephen, monitoring officer, would you like to come in?
Yeah, it's quite correct. Annual council appointed the members of the scrutiny committee, and there's been a resignation and replacement is sought at this meeting. So everything's above board.
Thank you. I obviously escaped my mind. Possibly other things on my mind at annual council. Thank you.
Okay. Thank you very much. I was asking if there's any other nominations for this position. No. Well, are there any persons, any members that are against the appointment of Councillor Joel Williams to the Scrutiny Committee, please? No. Then, Councillor Williams, you're duly elected to the Scrutiny Committee. Thank you very much. So, what is now item 13 on the agenda is the fourth quarter 2019-2020 financial performance report, which I'm handing over to our Chief Executive, Paul Masters, to introduce, and I'm sure Russell will follow. Thank you very much.
Yeah. Thank you, Chairman. Thank you, members. I just wanted to give some just broad overview before Russell goes through the detail of the report, and a big thank you to Russell for producing it. But it's just worth us reminding ourselves that the Council some years ago, found itself in a difficult position in terms of its external audit view, and since that time, officers and members have been working tirelessly to further improve our sort of corporate management grip of the authority. And this report shows that whilst many councils across the country are now announcing their out-term positions for the financial year with massive overspends, particularly in social care, that whilst we were heading towards a overspend at year-end, swift management action in the final quarter has managed to bring in a small underspend, which of course will be put into reserves as we obviously face quite a lot of uncertainty in the years going forward. So I just wanted to put on record a thanks to the finance team for holding all the officers to account and for the officers in taking swift action and bringing in a balanced budget for the council. Thank you, Chairman. Can I hand over to Russell?
Yes, thank you very much. Russell, 151 officer, are you able to update on the report, please? Thank you.
Thank you, Chair. Thank you, Paul. I will just run through quickly the salient points.